Looking for best hair transplant advice? I think you have come to the right place. I'm not bragging, but Saraswat Hospital has been providing state-of-the-art hair transplant services for more than a decade and a half. So let's hear today the journey of a person who was Norwood grade 6 to 7. His journey from baldness to head with good hair, with a sad-looking face, to someone who is sporting a Hawaiian shirt and cartoon t-shirts out of joy. So stay tuned for his story. And if you want to know how you would look after your hair transplant, even before getting the surgery done, how you would appear with your hair, you can take help of Saraswat Hospital Peak AI feature now, which is an algorithm which will tell you how you would look after your hair transplant. So we'll discuss this very soon in the middle of the video. Our today's patient was undergoing hair loss for past 10 to 12 years. Now he wants hair transplant treatment because he knows the hair won't come back. He has a family history of hair loss also. His father had significant hair loss. So first things first, we did a trichoscopy for him. With trichoscopy, we could find out that at the back of his head, at the donor side, the density of hair was good. It was around 80 grafts per centimeter square. The average diameter of hair was around 0.075, which was good enough, and there was sufficient hair to be put on his recipient area, not the whole of it, leaving the crown. So we could do his front and mid scalp up to the transition area. Please hit the like button and press the bell icon so that you are the first one to get more of such interesting and educational videos. His recipient area, when we measured and calculated, was around 132 centimeters square. We wanted to put a graft density of around 32 grafts per centimeter square, so we needed somewhere around 4,305 grafts. If you have any questions regarding treatment planning or your own hair transplant, you can write in the comment section below, or you can call us or WhatsApp us on the numbers below so that your query can be solved. So we drew a hairline for him. For the hairline, the doctor and the patient, we both agreed, and we already had told them that his crown will not be done in this session. Maybe we do it after 6 months, after we see the growth pattern of his front and mid scalp area. After sensitivity test of various medicines we were to use during the course of the day, we took him for surgery. We made the slits first so that we know exactly how many grafts we require, because we use a counter for the slit making too. Now we used a low torque, low RPM machine to take out harvest grafts from the donor site. After the grafts were taken out, they were sorted as 1 head, 2 head, 3 head, 4 head grafts under the microscope with good magnifying loops, and then they were put in the pre-made slits with our expert team. Sometimes people ask, doctor, will you be doing all the steps by yourself? So here I want to tell you that the slit making, in which the angle, direction, depth and density of slits matters a lot, because your hair will grow according to the slit only, and the graft harvesting. These are two major steps which are always done by doctors at our center. The graft putting in the pre-made slits, we take the help of our team in putting the graft under our supervision, and this is a standard procedure worldwide. We had given our patient a mature hairline and a softer, natural looking hairline. He came to us for review after 1 month, and then again after 5 months and 6 months. At 6 months, you can see his PRP being done and his hair combing video also. Now comes the result at 8 months. We should keep in mind that this 8th month result is not final. There are so many grafts still to come out, but at 8 months only, the improvement in his looks is drastic. He is very happy. Now he has started being cheerful, joyful, and as you can see from the choice of his clothes also, that he has changed. For more such authentic testimonials, please subscribe to this channel. Now you can see your probable results of hair transplant in 3 simple steps. Download the Saraswat Hospital app, click on the Peak AI feature and take the quiz. Upload your pictures. You'll be getting your result pictures within 24 to 48 hours. Also, you'll be able to see how many approximate number of grafts you would be requiring for your procedure, and a list of 10 additional questions which you should ask your doctor when you go for consultation so that you understand your procedure better and your queries are properly answered. So what would be the take-home message of today's video? Number 1, Giga sessions are possible, that is sessions of hair transplants. More than 3,500 grafts are possible in one day. Do see for the credentials of your doctors. They must be American board certified hair transplant surgeons. Also, they should be using latest tools and instruments. And also, there should be counter in their machine, the FUE machine which they are using, so that there is transparency in the number of grafts. And last but not the least, there should be team with dedicated phone numbers for you so that you can ask for help whenever you need after your surgery. Do share this video with someone who is suffering from such a hair loss and who needs help. If you want to see a video on cost of hair transplant, please click the link on the left. And if you want to see our latest hair transplant video, please click the video on the right.